My right testicle sits higher than the left, and the connecting cord, spermicord, on the right side is more sore to the touch than the right. Comparatively, my scrotum seems much smaller than others. Premature ejaculation occurs frequently during sex. When ejaculating, the fluid does not seem to shoot out but rather pulses out without shooting far. Finally, I recently donated blood and they commented that my blood is very thick and very slow to come out. I do not know if any of this is related or if I should see a doctor. I am in very good shape, no drugs, no alcohol, 32 years old, non-smoker, no health issues, although family history of heart issues, and no medications. Your input on whether to see a doc, and if so, the urgency with which I should see someone and what kind is much appreciated.
Hello. The most common causative factors of premature ejaculation are psychological factors like temporary depression, stress, anxiety, erectile dysfunction. Other factors are suboptimal amounts of testosterone in the body, too much alcohol consumption, some medical conditions like cardiovascular disease, diabetes, certain medications like antidepressants, changes in hormone level, imbalance of hormonal level. Psychological factors are the most common one. Also, you need tests to rule out other causes. I advise you to consult your psychiatrist. You need sexual therapy, the squeeze technique, prescription antidepressant medications and psychotherapy. I advise you to consult your doctor.
The premature ejaculation was only one factor listed in an attempt to see if there is a larger medical, non-psychological, issue of which I should be aware given the other characteristics I described.
It is normal to have left testis that hangs lower in the scrotum than the right. The left testicle also tends to be 7 to 10% smaller. They hang at different levels because they have separate arteries and veins that differ from each other in length, angle, and source. So this is not of concern and not an abnormality. If there is soreness in one testicle, then this can be due to infection or inflammation for which you need examination from urologist and a prescription medication, antibiotic or anti-inflammatory medication, may be required accordingly.
Relist, incomplete answer. Specific questions were asked: 1. How urgent is it to see a doc, and 2. What kind? They were not answered.
This is not an emergency condition. You can make an appointment with your urologist doctor for the examination of soreness on testicles and rule out the other causes, medical/non-psychological, of premature ejaculation.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.